Hello there, I'm Dr. Samir Kurzekar. I'm a local GP here in Brent. It's really important that people with long-term conditions such as diabetes, heart problems, lung problems and mental illness, amongst others, have an ability to really look after themselves and manage their health and care. And so GPs have worked with organisations to try and really understand how we can help patients to self-care for themselves better. So, for example, Mrs. Brown has asthma. She's really keen to get a good control on it and stop having so many flares, which have caused her trouble and have actually led to her having to go to hospital on a few occasions. And so she comes to see me as her GP. We have a chat, and as part of the chat, we think it might be a good idea for her to come and see one of our care navigators to see what more we can do for her. Mrs. Brown comes and sees the care navigator, who spends time with her, and as they talk, they realise that actually some of the challenges that Mrs. Brown has is she's lonely, she hasn't got as much support as she would like, it makes her quite nervous, and so together they try and figure out what could be available to Mrs. Brown out in the community. One of the things she can do is to start going to local groups where she can meet other people, get some more company, start understanding more about her asthma, maybe learn more about her medication. Also, that might help address some of her loneliness. Mrs. Brown's care navigator even helps out by going along to her first session with her. Over the next couple of weeks, Mrs. Brown and her care navigator work together to help progress through Mrs. Brown's goals, to help her to develop her skills, her confidence and her knowledge. She also starts understanding more about the asthma so that when she's having difficulties, she knows when she can come back to see me as her GP so that I can help her through some of those other challenges that she's also facing. This is an example of how the care navigators supported Mrs. Brown, but they could support anybody who has a long-term condition. So if you or anyone you know who has a long-term condition might benefit from the support that a care navigator can give, please go and see your GP to discuss it further.